So anaphylaxis. So if you came in and got your shot and you waited here 30 minutes, so that's why we make you wait for 30 minutes. That's why we make you get the EpiPen. And you were fine and you left, and let's say an hour later suddenly you start getting really tight in your chest or you start getting itchy everywhere. You got to keep in mind, hey, I just got my allergy shots. This might be anaphylaxis. So if that's the case, you're going to take your EpiPen. I'm going to use this as a demonstration. And you're going to uncap it. You're then going to stick it into the side of your thigh. So we will talk about this in a few minutes. And when you stick it hard enough, you're going to hear a clicking sound, which indicates that the little needle has come out. All right. When the needle comes out, remember that this is an automatic injector or auto-injector. The epinephrine in the pen, which is the chemical in the pen, also known as adrenaline, will automatically start coming out and going into that thigh muscle. It takes 10 seconds for the EpiPen to deliver that epinephrine into your thigh muscle, and you have to hold that pen steady after the click and count those 10 seconds. It cannot be 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. It has to be 1 Mississippi, 2 Mississippi, 10 real seconds. So 10 Mississippis later, you're going to pull this thing out of your thigh, and the device will self-cap itself, so most people never see the needle. You put the EpiPen aside, and when we give you an EpiPen, we actually give you 2 EpiPens in a pack. So you use this one already. You put it aside. Remember that you have this active one in front of you. When you put it aside, you've got to do 2 more things. You've got to lay down and put your feet up. The reason you want to do that is you want gravity to help keep the blood going to your vital organs, which is your brain and your heart. And you want someone with you or you to call 911. This is rare, but it's the most serious type of allergic reaction, so we want someone to come and take a look at you. Now, this pen starts working in about 30 seconds, so very quickly, all of those symptoms we talked about should be getting a whole lot better, and it lasts for about 10 to 15 minutes, during which time your body is going to turn around and start to fight this anaphylactic reaction off for you. So luckily, most people have mild to moderate anaphylaxis. So by the time 14, 15 minutes has passed, they're feeling better anyway, even as this is fading away. However, the ambulance in this country gets to you in about 5 minutes, give or take a minute. So when they get there, you're probably still laying there with your feet up, feeling much better. They're really just there to watch you. So as this runs out, they're going to be making sure that your body was able to fight this reaction off. So if you're feeling better, they will slowly sit you up, they'll watch you some more, and then if you're still better, they'll say, okay, go back to Dr. Khan and tell her what happened. Now, if this wears off and your symptoms start coming back, or now you're vomiting or having nausea and dizziness, then they're there to help you with that. The reason you have the second EpiPen is, let's say it's been 13, 14 minutes, your epinephrine's wearing off, and your symptoms start coming back, which, by the way, means that you had a much more severe reaction, and your body has not had enough time to fight it off. So the ambulance, for some reason, let's say, is not there. They are lost, they're stuck in traffic, they've had an accident. So despite the fact that you did everything I told you to do, you gave yourself the EpiPen, you lay down, you put your feet up, you called them, they're not there, it's 14 minutes later, your symptoms are coming back, you had a more serious reaction. This is why you have the second EpiPen. You're going to uncap it, stick it into the side of your thigh, hear the click, remember, and count 10 Mississippis, and buy yourself another 10 to 15 minutes. Now, I know that sounds scary, but keep in mind that this is pretty rare. We wouldn't have been giving shots for over 100 years, and that's true. Just to let you know, shots have been given for allergy since 1911, so we wouldn't have done it this long if this had been such a big issue. But it's fairly rare, but it still happens, so we've got to go through this part with you. All right, another thing to tell you is that EpiPen is not the only game in town. There's a competitor called AviQ. And AviQ is an epinephrine autoinjector as well, but it's shaped like a little cigarette pack. And it really is interesting because when you uncap it to use it, it starts talking to you. And it has a little digital electronic voice taking you through the steps. And it basically kind of runs through everything with you. I think with AviQ, it's only 5 seconds in the thigh when you have it there. And then when you take it out, it will tell you now, call 911. The only thing it doesn't tell you is to lay down and put your feet up, so you have to remember to do that yourself. Very important. Last few things, your insurance company usually pays a bulk of the cost of the shots. You may qualify for the rush protocol, and that'll just depend on your particular clinical history. But that's basically when you come in for a day almost in our clinic, and you get a lot of your buildup done in that one day. So progressively stronger shots every 30 minutes during that day. The night before, we give you a bunch of medications, allergy medications, to keep your body kind of calm during that. And then the morning of, you get the same medications, and then that day you come in, you bring something to do, you bring your laptop, you bring your iPad, you bring a book, whatever, and then during that day we're giving you those shots. If you're qualified for that day and you can do it, we can actually finish up about 20 to 22 weeks in that one day. So basically you're 6 months ahead by the time you're finished with that day, and you only have about 11 weeks left before you get to your maintenance dose.